Hello everyone, welcome back to my channel. In this video I'm going to talk about homeopathic medicines which are really kind of useful for treatment of anxiety, fear or the fright, where the person who is suffering from the anxiety of mind is very much difficult to cure. But in homeopathy, of course, it's possible because we have so much of remedies which are really kind of helpful in treating these kinds of diseases. So, without any delay, I'll be only covering one of the biggest and most important and always used, repeatedly used medicine, that is the aconite nepalese for the anxiety of mind. Okay, myself, Dr. Megha. I am today talking about homeopathic medicine for the anxiety of the mind. So I'll be talking all about the mind of the aconite nepalese, where how the aconite nepalese people will be. Seriously, you guys don't even kind of imagine about it, because it is one of the means regularly used medicine for the mind symptoms, because the homeopaths always thinks of aconite whenever it comes to the fear, fright or fear of darkness, or something which is starting suddenly and something which is starting violently, something like that. So this remedy is really kind of very fantastic remedy for the anxiety, and the spear of action on the mind is really kind of excellent. And it is a kind of means works very well in the circulation kind of thing, but it has also kind of means in the acute kind of fear, or in the acute kind of anxiety, in acute kind of means the patient will be like, I was about to hit someone with an accident in a scooter. So that kind of fear has come into mind whenever I go to that cross or something like that. So when that person is saying in this acute kind of case, you can just give the aconite nepalese 30, so it will be curing them. But keep in mind that in the acute cases, means in the case where it is only in a shorter duration, we call it as acute cases. So when these things happen, there is a repetition of doses is being done. So the repetition of medicine is that if you take aconite nepalese 30 in the morning, in the night also you should be taking, so you should be continuously taking it for 1 week, so that the symptom get recovered. After 2 to 3 days, of course, the symptoms a little bit slow down for you, the fear goes away, but you should not stop the medicine, because it will be in the subconscious level also. So to treat it from the root cause, you should always take it with an full course. So you should be taking the medicine for 1 week in the acute cases, but in the chronic it is not like that. In the chronic cases, means it was some others, means the death of the father happened suddenly. Because of that, the fear has set in that girl or the boy, and it is an chronic kind of anxiety. During that time, what you should do is chronic kind of anxiety or chronic kind of fear. During that time, what you should do is that you should be taking the aconite nepalese 200 or 1 m. I prefer 1 m, because in the chronic disease, when it is in the mental sphere, of course you should be taking in the higher potencies. So 1 m, a repeat after 15 days, one dose for 15 days, that's all. There is no need of taking any kind of medicine in between, so it will cure all kinds of things. So let's talk about what all the symptoms which the aconite nepalese covers with the anxiety, fear of the mind. Okay, the first keyword of the aconite nepalese is tension. Means that person will be tension. They will be always walking in tension here and there. They will be like tick tock like. And it is a kind of very peculiar kind of a symptom, where you can really find out when you see this in a person. You can find out that okay, aconite is going to work for this person. This person is aconite. Why this person will be in so much of tension? Because due to the irritation of the mind and due to the affection of the circulation, and there will be so much of tension in the aconite patients. So it is also given in the first stage of any acute cases, which starts suddenly and violently like an storm. Means it comes like so suddenly and violently, and it also leaves like that only. The way it came, the way it goes, the same thing is there in the aconite. So this is one of the peculiar symptom, and the patient will be always saying it came so suddenly. Means all the symptoms rushed into that person, but after some time all the symptom went away the same way they came. So the patient will be kind of saying this, and they will be kind of in a very restlessness way, and it is also called as trios of restlessness, because in homeopathy we have some symptoms which we call trios. Means three drugs will be covering the same symptom, where you can think of trios of restlessness. You can think of aconite nepilus and arsenic and rustox. When arsenic is given when there is an external injury, when there is an mental kind of anxiety, fear and everything. Means mental kind of thing. When it is affected to the mind, you can think of aconite, but when it is affected to the mind, you cannot think of arsenic. Only with the physical, means fracture of bone or fell down something like that. And another one is rustox is because they have so much of burning inside them. Of course the means arsenic also kind of follows it, but seriously you can think of rustox in a patient who is of old age and some kind of bone related symptoms. But when it is purely of tension and the person is very stressed, and the person is saying that I the symptoms are very kind of sudden and everything, you can think of aconite nephritis. Okay, next one is the one of the biggest. There is great fear and the anxiety of mind. Intense nervousness will be there in the patient. The face of the aconite expresses fear. Means when you see them, you will be knowing that they are in the fear. So that type of fear will be there. So the patient will be very much kind of nervous, and they will be showing it to you also. They will be in a very great nervousness, and the face of the aconite patient only expresses the fear. The aconite patient has fear of so many things, like fear of death, fear of acute diseases, fear of darkness, fear of bed. Even going on the bed to sleep, they have a fear because of the darkness. And fear of ghost, fear of going outside and crossing the road, fear of crossing the road, fear to go into the crowd where there are so many people and everything. They have fear for everything, even the fear of crossing the street or crossing the bridge, where they will be always kind of an tension, and they will be always restlessness. This will be running throughout the whole track. The fear and the anxiety of the mind is very great in the aconite nepilus. And next one will be the fear and the fright, where the fear and the fright is the most characteristic of aconite. Fear of death, and the patient even can say that at this time death is going to happen of mine, something like that. He feels that the disease is um, very means even if he is having a fever, he just thinks that it is very big diseases and he cannot get cured. Because of that, is going to surely going to die at this time, something like that. So he will be having so much of fear. But the seriously the patient he's so restless and so restless, he makes everyone inside his room also restless, because he will be continuously talking, he will be asking the people to come, and he will be calling his friends and around, means he will be saying, can you come and accompany me, because I'm in a such kind of thing, there are so many things which has happened to me, this, that, and everything. He wants emotion which should be shown to him. And the patient is very much restless whenever there is a disease for him, whenever he is in a fever, or whenever he is having gastric symptoms, something like that, he is very restless. He does everything in a great kind of hurry burry, so he will be like that. And he must be keep on changing the position quite often, means he will be sitting here and he changes the position, he'll be going and sitting somewhere else. But sometimes he may also kind of just put his leg upwards, then remove the leg, or put his hands in the head and take it out, like that. He will be very restless and continuously changing the position. And one of the peculiar symptom which you can really kind of think of aconite is, the patient says that I always feel like whenever I get a fever, or whenever I get a fear, something like that, I can kind of predict the date and even the hour of my death. So the patient will be saying that, of course it's not true, but the patient will be saying that, okay, this is like on this day at this time, this thing are going to happen, like that. But seriously, it is because of the anxiety, or it is because of the fear, or it is because of the fright. But seriously, there's nothing going to happen according to, they only think like, okay, this is the things which are going to happen to me, so I should be prepared. So he will be always calling his friends, his mom, his family, everyone, and informing like, this thing happened with me, these things are running out like this, and can you please accompany me, because like this has happened, that this and everything. Because that person will be having so much of fear, because he has fear for everything. See, fear for darkness is there, fear for ghost is there, fear for going out is there, fear for crossing the road is there, fear for going into the crowd is there. If that person is a working person, of course he does not go to the office, but he calls and says that, can you come and accompany me, because there is no one. Of course there will be so many people, but still he calls out the people. So he always wants everyone around him, because he is very much fear about the darkness and everything. Just imagine, how can the person even get fear of going to the bed? So that type of fear will be there. To control the aconite patient when they have the fever is really kind of very great thing, because they will be having so much of fear. They will be holding the hand, they will be always with asking someone to be there for them, and they will be always thinking like, okay, something bad has happened to us and something is going to happen to them. And there is great fear and anxiety of the mind, and there is great nervousness also, which runs to whole remedy. And one kind of thing which is mostly, means according to my clinical practice, I had seen the patient saying that, means compared to the male patients, means compared to the boys or the men, I see that the females or the girls say this sentence, means the music is unbearable and it makes us so sad that we start weeping. Means when the aconite patient is sitting in a room, so you goes, some friend comes in, and that friend is like, okay, happy go lucky, like that. So that friends kind of on some kind of jolly song only. But when that song comes, this person really starts weeping, because they does not enjoy the music, they does not put their emotions in the music, they only go into the lyrics. Even if it is an happy lyrics, they just remember about their sad moment when they was happy, means they was happy and sad thing happened. After that they remember that and they start weeping. So the music is unbearable and it makes them so sad and they start weeping. So it is mainly seen in the women's, as per my clinical kind of view. Of course it can be seen in the men also, because uh, you can just take into the percentage, like 80% of women may be seen, 20% in the men's also you can see this symptom. But why I am mentioning is this, because if you are looking for an aconite nebulous for the anxiety or the fear or the fright of the mind, first you should be going, the person is very tensed. Okay, the tension is there, the restlessness is there, and he knows that there is something, means at this date, at this time, something is going to happen to him. So he has that kind of illusion in his mind, and he also kinds of go and ask for so much of help. And this kind of thing if you collect, and if that person is not saying that, I does not, means if you ask a question like, the music, how you are feeling, the person says no, it's okay, I can enjoy the music, means you should not leave out the aconite when that symptom is not included. At least the three symptoms are matching, then you can go for, because these three symptoms will be very much peculiar. It will be in almost 99.9 cases, then only you can think of aconite. Okay, next we will be talking about the great restlessness, because the restlessness is so much that the aconite nebulous is also called as trios of restlessness. You can be asking like, which are the other two remedies, which I had already mentioned, that is one of is the arsenic, and one will be like restox. Restox restlessness is because due to pain, burning and everything. Here the arsenic will be like, burning is also kind of there, but they will be having fear of losing something, means losing the money, like that, means they will be very restless, like going and checking the logs, going and checking their pockets, going and checking their money, something like that. But here the trials means when it comes to the aconite nebulous, but the aconite nebulous persons are also kind of very restless persons. But seriously, the restlessness goes like, it is because he does everything in a hurry burry, because he thinks that okay, the time is been moving fast, so within this time I should finish up all the things which I really want to, because something is going to happen at that time. So because of that, he will be very restless, because he can predict the date and even the hour, I had already said. So because of that, they will be very much kind of restless. So that's all for the aconite nebulous, which I am covering today. Homeopathic medicines for the anxiety of the mind and fear, fright of the mind. You can be thinking about. So now we'll be talking about aconite people, how they will be getting affected. Means there will be one or the other cause for the disease, right? Means if you had went out, and if you had went out in a rain, so you got next day the fever, so like that, so that will be the cause, means the rain will be the cause, or you do the work, because of that you get pains, like that. So we'll be talking about the causative factors about aconite nebulous, so which will make the patient get into the fear or anxiety. First one is exposure to dry cold air, means the winter season, so dry north or west wind also. So exposure to the cold air, aconite peoples are very chilly persons, means they are very sensitive to the cold. So exposure to the cold air during the winter, of course they will be literally in a lot of trouble, and their skin will be very dry, because the aconite also kind of covers the dry hand, kind of a skin, which will be very dry, and the skin will be very hot also all the time. So the Aconite people cannot even kind of sweat easily, because the sweating is more whenever they get into the anxiety or whenever they get into the fear or something like that happen. Because of that sweating, of course there will be so much of itching, because their skin is already dry and it's cracky. So due to sweaty kind of thing, of course there will be itching and everything because of that. Then there is a great kind of fear. I already said there is a fear of darkness, fear of ghost, fear of going out, fear of going into the crowd, fear of crossing the uh, street, fear of crossing the bridge and everything. So everything is kind of very fearful for them. So we will be ending this video with the generals, means what all things will make the aconite patient worst, means their symptom will get worst during this kinds of thing. Means first one will be during evening and at the night time. Means during the morning they will be okay, but during the night and during the evening, of course there will be so much of fear, fright and anxiety, because there is an mm, darkness which is coming. So they get feared when the evening comes up. So the pains are very unsupportable. And in the warm room also they cannot tolerate themselves, because it's very sweating kind of thing and everything. When rising from the bed, means they does not want to get up, or they does not want to go outside, they does not want to do the things. They have this kind of fear. Because of that, rising from the bed is also kind of making them a little bit worse. So lying on the painful side, these persons are very sensitive persons, both mentally and physically. The pains are very means sensitive, means the means a normal person, means the restox is also a kind of restless remedy, but the restox people will be saying no, there is no pain. But if that pain is present in the aconite nebulus, they will be saying that, oh, we are in so much of pain, the pain I cannot be able to bear it, can you please give me some medicines, like that. That kind of sensitiveness will be there. Because of that, they cannot lie on the painful side, so they will be always lying on the opposite side. So when they will be okay, means when the aconite patient will be feeling better. Because how you can understand this is, just imagine that some people who is having a pain in their hand, some people likes the pressure, and giving that pressure will take away the pain. When they release the pressure, of course the pain comes back. But some people, they cannot take the pressure like aconite nebulus, because it's very painful for them. If you touch also, it will be very painful, like that. So in the open air, the aconite patients will be a little bit better, because they feel so free and everything. So this was my video about the homeopathic medicine for the anxiety of mind. Of course you can think of fear and fright of the mind also. So today I covered the aconite nebulus. It is one of the polycrus remedy of homeopathic medicine, which is prescribed for the uh, anxiety of the mind. Because of that I selected, and it is one of the biggest medicine, but I only covered up the mind symptoms. So I'll be in the upcoming days, of course I'll be discussing about other symptoms, other kinds of thing also about this remedy. Okay guys, if you really like my videos and this video was really helpful for you, please do like and subscribe and share my videos, and don't forget to press on the bell icon, and don't forget to press on the subscription button. Whenever I put a new video, of course you will be notified. So if you have any kind of recommendation for me about any homeopathic medicines which you want to know in the future, you can comment below in the comment section, so that I'll be looking on that and I'll be also working on that. Okay, then I'll be signing off from this video. Myself, Dr. Megha. I'm an homeopathic doctor, MD in homeopathic Metra Medica. Thank you. Bye bye. Have a nice day.